When the diagnosis is cancer, treatment often involves radiation therapy, but that can kill not only the tumor, but surrounding healthy tissue. Until now. This is part of the next generation of radiation therapy, so-called 3D units that better image the tumor and treat from 360 degrees as compared to 180 degrees in older units. In Nyack, 20 miles north of the Big Apple, there's tomotherapy. Patients initially undergo a CT scan to locate the tumor. A physicist then plots out a treatment plan, but before every treatment, another CT scan.
Some cancers can move a little bit day to day inside the body. Like prostate cancers can move, so can intra-abdominal organs can move. By doing a CAT scan, number one, we can limit the margin around that where we would normally have to account for that movement. Second, we can actually watch the tumors on a day-to-day basis, which we never did before, and if there's significant change, we can adjust our radiation.
This way, as Dr. Gerstli explains, they're able to better sculpt the tumor and keep radiation away from healthy tissue. In Latham at Community Care, there's image-guided radiation therapy, IGRT, where they say they paint the radiation dose over the tumor. IGRT also starts with a CT scan and treatment plan. Dr. Puranek also may implant a gold marker to help pinpoint the area needing treatment. Then, prior to treatment, another CT or X-ray or fluoroscopy is used to ensure just the tumor's targeted. That's done by this unit with robotic arms which move around the patient.
So with this technology, we can image just before treatment, and next second the machine turns on. And
then the radiation from 360 degrees is delivered.
When you go from all different angles, you can minimize dose throughout the body, towards the contour of the patient, and maximize the dose right in the middle where the tumor is located.
These 3D targeted radiation treatment devices are best on tumors of the prostate, head and neck, pancreas and spine, or other tumors deep within the body where spillover radiation can have devastating side effects.
This one has less side effects because we can make our beam smaller because we know where we are every day. In previous times, we had to allow for margin of error, and so we would have a larger area for treatment so we don't miss it every day. But now we don't have to put that kind of margin.
Just ask Clark Hayward, who just wrapped up treatment for prostate cancer. This active father of 3 says any concerns he had were dispelled early on.
I felt great. I had no interruption in my normal daily activities. You know, I run, I bike, I kayak, I do a lot of things, and I felt great during the entire course of the therapy.
Older 2D radiation treatment is still appropriate for many tumors, but Dr. Puranek expects the 3D therapy to reign within the next few years. And the next advancement, says Dr. Puranek, is to look for radiation therapy that keeps taking those CT images as the radiation is being delivered. So if there's any movement while therapy is going on, it'll be able to adjust for it.
Now, as this thing rotates 360 degrees around the patient, does the beam automatically cut off so an organ that's near the tumor isn't affected?
It's pre-programmed, so it knows exactly when to shoot and where to shoot.
Wow, fantastic stuff. Thanks, Benita.
Still to come on News Channel 13 Live.